Hello, you guys. My name is Maggie, and I am from the Weller Center at Lehigh Valley Hospital. Some of you may recognize me from when I came into your schools and taught you guys face-to-face. Some of you may not, and that is perfectly okay. What the Weller Center does is we travel to a bunch of different schools, and we just teach different health programs. So I teach a lot of different things. I teach things like stress, anxiety, vaping, drugs, puberty, a lot. But for you guys today, we are going to be talking about depression. Now, depression is a really huge topic. Millions of people all around the world suffer from depression every single day, especially teenagers. So it's really important that we talk about depression. We talk about what it is, how it can affect your body, how we know it's an illness, and how we can treat depression. Now, later on this video, I am going to be talking about suicide, and of course, I am discussing depression overall. Now, I know suicide and depression are not exactly the most cheerful topics, believe me, I am well aware, but they are very important to talk about. Now, I understand suicide and depression can be a little bit triggering for some people. So if you are triggered by the idea of suicide and depression, please reconsider watching this video or talk to your teacher about watching it at a later time or in a different format. Alright, you guys, let's get started. Alright, you guys, so let's get started talking about depression. So I have some goals for us for today. So my goals, first we're going to define depression. We're going to talk about what depression is, what that word actually means, and then we're going to talk about the differences between sadness and depression. So the differences between just being sad every once in a while and truly having medical depression. Next, we're going to understand the symptoms of depression, so go over those and what qualifies having depression. Discuss how we know depression is an illness. Next, we're also going to talk about suicide too. Now, suicide I know is not exactly the most cheerful topic, and it can be a little tough for some people to hear about. So if any of you are triggered by suicide or hearing about suicidal thoughts or tendencies, definitely reconsider maybe watching this video or talk to your teacher about watching it at another time. Next, we're going to go over how to better manage the symptoms of depression and how to manage it in our everyday lives and maybe have a little bit more of a positive outlook. All right, let's get started. So first, let's talk about what is depression. What does that word actually mean? Now, a lot of people use depression in their everyday conversations, and a lot of people hear about depression, but not everybody is sure about what depression actually means. So what is major depressive disorder? That's what it's actually called. So depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. So I really like this definition because it talks about all those different ways that depression affects you entirely. So a lot of people think having depression is just being sad, and that's not what it is. Depression is a medical illness that actually affects the way you think, how you act, and your mood too. So depression is a lot deeper than just being sad. There's a lot more to it. It's a medical illness that's going to affect your body, and you have no control over it. People don't choose to have depression. Depression just happens. Just like you don't choose to have cancer, or you don't choose to have the flu, or even the coronavirus. You don't choose any of that. It can just happen to you. You just catch it. And that's how depression works. So what is the difference between depression and being sad? Well, being sad is temporary. It goes away. We all get sad sometimes. Life is pretty terrible sometimes, guys. I hate to be kind of a negative Nelly, but sometimes life can just really suck. Some bad things can happen to us. And when you're sad during those things, usually it goes away after a little while. So if you get an F on a test, if you and your significant other break up, if you even lose a family member, you're going to be really sad about it. But after a while, that sadness is going to go away. Even if it feels the same as depression, so even if your body is affected and your mood and the way you think, even if all of that is affected and it feels like depression, it goes away after a few hours, days, or even a week or two. So it is temporary and it does go away. Now, the difference between sadness and depression is a medical illness that lingers for a lot longer. People are affected by depression for weeks, months, or even years of a person's life. So I want to go over the symptoms of depression. Now, before we go over these, I want you guys to keep something in mind, something here at the bottom. To have diagnosable depression, you have to have 5 or more of these symptoms for 2 weeks or longer, because like I said, depression is a long-lasting illness. Now, some of these kind of look familiar. Some of these may be things that you kind of feel in your day to day lives. That is okay. It's okay if you feel some of these sometimes. That doesn't necessarily mean you have depression. So, I don't want you guys to all watch this video and suddenly think you all have depression. That is not the case. So, it's okay if you feel some of these. So, for example, the first one is sad, low, or irritable mood, or just kind of feeling nothing. Again, like I said before, we all feel sad sometimes. That doesn't necessarily mean you have depression. So again, it's 5 or more symptoms for 2 weeks or longer. So, another symptom is decreased interest in activities. So things that you used to be interested in, you're not really into it anymore. So maybe you love playing basketball, you're on the team, you play with your friends every single day, but lately, you're just not into it like you used to be. You don't really care about it anymore, and you're just not interested. Change in appetite or weight. So maybe you don't really have an appetite anymore. It's really hard for you to eat. Or maybe it's the opposite. Maybe you're overeating. You're eating way too much. Sleeping more or less than usual. So you have a hard time sleeping at night, or you're oversleeping. You're sleeping all the time. Feeling restless or slow down. Fatigue or loss of energy. And a lot of people can be really affected by this one. I had a friend back in college who really struggled with loss of energy. He would just stay in his bed for days at a time. He would skip all of his classes because his depression made him lose all of his energy and his motivation to do other things. Decreased concentration, so you can't really focus. You can't focus on class, you can't focus on your schoolwork. Feelings of guilt or worthlessness. You feel like nobody cares about you. You feel like you're a burden. You feel like you don't matter. Reoccurrent thoughts of death or suicide. Now, I mentioned to have depression, it's 5 or more symptoms for 2 weeks or longer. This last one is kind of the exception to that rule. So if you ever have thoughts of death or suicide, make sure you tell somebody right away, because that probably means you are suffering from depression. So again, this last one is the exception. And if anybody ever mentions that to you and they ask you to keep it a secret, tell another adult anyway, because that person seriously needs some help. Alright, so how do we know depression actually is an illness? So depression is a medical illness, and there is a lot of scientific evidence to back that up. There is proof that depression is an illness. One way we can prove depression is an illness is by actually scanning the brains of people who are depressed and comparing them to people who are not depressed. So scientists do these studies all the time, and it's so interesting to me the difference between a depressed brain and a not depressed brain. We can physically see the difference between the two. There's major differences. So the depressed brain is not lighting up the way a not depressed brain does, and they do that in different MRIs. That's really crazy how physical depression can actually be. Another way depression is an illness is it's genetic. It runs in families. Now, just because your family member may have depression doesn't mean you're guaranteed to have it as well. You don't have to worry about, oh, my mom had depression, I'm definitely going to have it. That's not how it works. It just means if depression runs in your family, you are at a greater risk of developing depression sometime in your life. It's not a guarantee, but it just puts you at a greater risk. It's the same way alcoholism works. So in some families, there runs a risk of alcoholism. So just because your parent is an alcoholic doesn't mean you are guaranteed to be one also. It's just a higher risk. And again, it's really crazy how we can actually see it run in families. You can see it on family trees. Somebody's grandparent may have depression, then your parents may have had depression, and then maybe you have depression as well. Next, depression is something that affects so many people, and no one is immune to depression. You have no control over whether you get it or not. It's an illness that doesn't just pick and choose. So celebrities and rich and famous people are affected by depression. For example, The Rock, Dwayne "The Rock" Johnson. To me, he's such a positive guy. He's always smiling. He's always having a great time. He just seems like an all-around happy person. He is somebody who's affected by depression. So it doesn't matter how much money you have, how great your family is, or how perfect of a life you might have. You can still have depression. Depression doesn't just go, this person's rich, I'm not going to affect them. This person is poor, this person has a bad family, I'm going to affect them instead. That's not how it works. So it doesn't matter how much money or fame you have, nobody is immune to depression. Just like you have no control over whether you get cancer, pneumonia, the coronavirus, or the flu. So I also want to talk a little bit about suicide. So for some people, depression gets to a point where they actually consider ending their own life, and that is what we call suicide. Suicide is when somebody chooses to take their own life. And suicide is a really terrible thing because those are deaths that could have been preventable if people had gotten help. Now, suicide is very common in younger people, and the rates are going up every single year. So, unfortunately, suicide is the second leading cause of death in youth ages 15 to 24. So, teenagers, people your age and my age, young adults, suicide is the second leading cause after accidents. That's insane. That's such a huge amount. And I can't believe something as simple as suicide is such a huge causer of death in young people. That's something that could have been preventable. So all of those deaths by suicide, every single one could have been prevented if those people had gotten help and were treated for their depression. Someone in the world dies by suicide every 40 seconds. Guys, I've been talking for about 10 minutes now. In that 10 minutes, around 15 people have died just by suicide somewhere in the world. And unfortunately, 1 in 12 teens attempt suicide every single year. Think about the people in your class, you guys. On average, you may have around 20 kids in your class. Between 1 to 2 of those kids will attempt suicide this year alone. So we have to try and do something about it. We have to help our friends and family to prevent these suicide deaths because the numbers are only going up. And we hope that one day these numbers will go down. So if you or a friend is seriously considering suicide, then please, please, please seek help from another adult as soon as possible. Talk to your parents, talk to a teacher, go to your guidance counselor, and tell them you may think you have depression and you're considering suicidal thoughts, because we want to make sure this doesn't happen anymore. We want to try and help our friends and family. And on the bottom here, I put the suicide hotline. So if you ever consider suicide, please call this hotline immediately so you can talk to a mental health professional so we can stop that from happening. And if a friend mentions to you that they're suicidal and they're thinking about hurting themselves or ending their life, but they ask you not to tell anybody or to keep it a secret, tell somebody anyway. Because you don't want to have to live with that guilt of knowing that you could have helped your friend, but you didn't. So please talk to your guidance counselors, talk to your teachers, and just tell somebody right away. Never ever keep that to yourself. We want to try to help our friends and family. So what can we do for our depression? Well, unfortunately, you guys, there is no cure for depression. There's no magic pill that's suddenly going to make it go away. There are treatments that you can do. So if you think you have depression, you have to get treated for it by a doctor or another professional. They can prescribe you medications that can actually make a really big difference or get you into therapy. But the first step is to talk about it. Talking about it with another adult. I know the idea of it seems hard, and you feel like nobody will understand. But I promise you they will. They will understand and they will help you through it. Some other things that you can do to kind of help your symptoms a little bit more are things like exercise. Now, exercise is not going to suddenly cure your depression, but it can help make a big difference, especially for people who are struggling to get out of bed and just go about your day-to-day life. Exercising is an excellent way to help with depression because it gets your body moving, it gets you out of the house, and it helps your body in a really healthy way. Next is to practice mindfulness. So that could be things like yoga, meditation, deep breathing. Even just being aware of your own feelings is all mindfulness. Being aware of how certain things and people will make you feel. Those are all things that will affect your feelings and affect your depression. Next, maybe try to surround yourself with positive people. This is something I really and truly believe in, how the people in your life can make some of the biggest differences in your own mental health. If you're surrounding yourself with really positive and really upbeat people, it's going to make you feel better. Whenever I'm feeling my worst, I go and I try to hang out with my friends because as soon as I do, I feel so much better. They bring me so much joy, they make me laugh, and I just feel happier. But when I surround myself with really negative and toxic people, that makes me feel so much worse. I feel low. I feel really down when I'm around those types of people. So if you notice that there are certain people in your lives who are very toxic, very negative, maybe you want to limit your time with them and be aware of how they actually make you feel and how they affect your depression. Alright, you guys, thank you so much for watching. I really do hope you learned a lot about depression in this video. And please remember, if you are ever having suicidal thoughts, you think you may have depression, please reach out to another adult. I know it may seem scary and that it won't help at all, but it does. It makes a huge difference, and we want to get you guys help. So please talk to somebody if you think you may have depression or you're having suicidal tendencies. Alright, you guys, thank you so much for watching. I hope you have a great rest of your day. See you in the next video. Bye!